Hi, welcome to Facebook Live through the Health Department. I'm Annette Mercatante, the Medical Health Officer, and we have with us...
And I'm Justin Westmiller, the Director for Homeland Security and Emergency Management.
I was going to say my partner in crime, but
there you go.
We're doing the good work. So we start out every week going through some data. This data is available to you whenever you want on our Facebook, or excuse me, on our website, secchealth.co. Always forget that. So go there anytime and you can see this, but we're going to go through this very quickly. Oh, are you going to scroll for me? So this is what you'll often see. First of all, it's numbers. It's daily cumulative numbers, but we also include the new cases since the last update and our current active cases, as well as some of our hospital capacity data. We're reporting out every day what the percentage of hospital cases that are COVID related and what our hospital capacity bed is in general. So that's available to you every day. And then the next slide, please. We also provide the map that gives you some idea and understanding of the distribution of the confirmed cases that we have. And as you can see, we have confirmed cases throughout the county. Again, the larger amount of numbers is in the more heavily populated areas. When we do the cases related to the population, we do not have a hotspot. The percentage of cases in each area relative to the population, they're not equal, but for a community our size, I can't say that there's any one community over another that's having a significantly greater problem. Next slide. And then this is important because more and more we need to move away from total numbers, because total numbers are just going to continue to go up as we continue to have this issue. What we want to look at is where we are in this whole crisis. Are we stable? Are we going up? Are we going down? And the way to do that, we have to calculate rates. This graph is going to be shown every week. It's the average number of new cases per week. And we have to average the new cases because we have such variability between 2 and 5 and 10, and the graph would look like this. So we average them out, and you can see that since early April, we've had a continuous stable or declining rate. Now we had a little blip there last week, and we're coming back down, which is reassuring. But I go back to the fact when you have small numbers and small rates, they are not statistically reliable. The variability is much greater when you're working with small numbers. So you can't automatically assume that a small increase is significant. So we have to look over time the way this is trending. And the trending here, I would say, is favorable. We're not done, the disease is not gone, but we're certainly not trending upwards. And finally, the last piece of information that we'll be looking at regularly now is our testing capacity. The more we test, the more we can identify people with disease, the quicker we can isolate and quarantine their contacts. The way of containment of this disease at this point is still physically separating those who are carrying the virus from those who are not. And so the testing capacity, as you can see, this is cumulative as well, but you can see that we have every week increased capacity. We're going to continue to work on that, and I'll hopefully reach that. And then the next slide is the percent positives of our tests. And you can see that we've gone from almost 23% positive rate down to under 9%. This tells us that we're testing more people, and that 8 to 9% is probably closer to the true reflection of the amount of virus in our community. So as we test more and more people, we're going to see a lower positivity rate, but then we're going to have a much greater sense of security when that rate goes up. We're going to keep that testing capacity where we are, and as the rate goes up, we can go, oh, there's more virus in our community. Because way over here, you know, we were only testing people who are ending up in the hospital very sick. So it's hard to use that as a gauge as what the virus is doing in the community. Next slide, please. And then finally, I just want to highlight our dashboard that's on our website. It's updated Monday through Friday, and you can go back and look at all the information. It's interactive, and I think you'll find it very helpful if you just want to recheck the numbers. So that's our data for today. And let's move on to your questions.
Before you move on there, I'd like to point out that in the last 10 or 12 days, I think we received 7,000 test kits in the county, and that is a big jump for us from where we were in the beginning of this event.
Correct.
And we continue to work towards growing that test kit number We're working with the state to get a couple more thousand here, I think, before the end of the week, right?
So you tip the hat, but I do want to say now that we have a sense of ongoing capacity to get the testing material, our next step is to develop systems of testing that are markedly less barrier-ridden. So testing that doesn't require a physician's order, testing that is clearly free, testing that you don't need a vehicle to drive through. So that's coming. We're working on that very hard, and stay tuned because we know that's what we need, and we're going to get there.
Right.
Okay, why don't we start off with question number 1 for each of you on your sheet.
Okay,
All right.
why don't you go first? Because I just
All
got
right.
talking.
So the first question I have is, how is the EOC helping with the current pandemic? Well, the EOC obviously is available and ready to help in many different issues, crises, and things like that. But currently, one of the 3 things that the EOC is managing is it's serving as a centralized location to monitor and respond to the report of the impact or emergency that this pandemic is doing. And we're doing things like managing supplies, managing PPE, managing responders and their needs and what they could request into the EOC and how we could facilitate those requests. If there's personnel needs, if there's equipment needs that they don't have on hand, sharing anything unique that could come into the EOC or needs to come out of the EOC, and information sharing. That's a really big one. That's something that we're doing here at the health department. We're working hand in hand with the health department, with the staff here, with their unique capabilities. They're able to share their information with us at the EOC, and we push that out to all the community partners as well as our state partners at both the CHEC and the state EOC, and we just share that information back and forth really, really well, and that's our key to success so far.
Okay, the next question is, why is the health department no longer providing daily updates on the weekends? And the simplest answer is this is a marathon and we need to pace ourselves. Our staff has been working long and hard hours, and it's difficult to maintain staff over the weekend. Now, with that said, it's not like nobody's paying attention. There are people that are still checking the MDSS system, making those urgent calls. I am on call 24/7. I can be reached. So it's not like we're not here monitoring the situation. But the information to give you got to ask yourself, it hasn't changed, doesn't change that much right now. If the need to start reporting 7 days a week rearises, we'll do it. But right now we don't think it's really necessary. And honestly, we just need to give ourselves the ability to pace ourselves through this event.
So the next question I have is, what changes are we going to have to make on how businesses operate to maintain our economy, such as providing social distancing and many other things? And the governor was pretty clear through Executive Order 97, and in some of those areas, there are 13 areas that provide some of those details in the executive order, but a lot of those things are such as businesses are required to provide a plan, and they're required to train the employees on those plans, provide that distance, the 6 feet of distance at each employee's workstation, provide personal protective equipment, things like that. And the governor's EO requires that you follow all of these things. And I know the health department's working on some information. I know the EOC's working on some information, and there'll be much more to follow on that. But there is a lot of information in EO 97, and if anybody has any questions, you can refer to that document as well.
Big picture is that I would assume every business and agency and congregation is going to be interested in making sure that the people that come and go out of their building and work in their building stay healthy.
Yeah.
Because in a pandemic like this, where a lot of people can get sick at the same time, you can lose your workforce like this. Or just say you become a hotspot of St. Clair County, who's going to frequent your business, right? So all of a sudden it becomes very important for everyone to do the right thing as far as health issues are concerned, because it really can bring people down. I think that's really a big thing that's going to change. It's not just about regulations and rules, and it's really about maintaining the capacity of your workforce.
So there's a rule side, there's a human side, right? And then there's a rubber meets the road, taking it back to the people and getting
balance?
Our community back on track,
Yeah.
right?
And dealing with the fear, because we know that a lot of people are fearful of going back to work, or are concerned about what their exposure is going to be. And we're all going to have to learn how to deal with that new sense of risk.
Right.
And that is something I think we're going to all have to do together.
I agree.
Okay. We have questions that had come in.
Yay.
So I'm going to answer those, or ask you those.
You
First
can answer them
question.
if you want.
Is this virus more contagious through air contact than surfaces?
Is the virus more contagious through air contact than surfaces? And I would have to say yes. So far, there's very little documentation of transmission through inanimate objects. Almost all the case management that we've done, the tracing, is person to person. One person has it, the next person who lives with them does. So I would say absolutely your biggest risk of getting this infection by far is being within 6 feet of an individual who's shedding the virus for longer than 15 or 20 minutes. Transient walking by a person is probably not going to be a big deal, but if you stand and chit-chat for an hour close together and you're not wearing your masks, that's when you're going to get nailed.
Okay, next question. Is there a magic number where we are shooting for to say that it is safe to start to resume daily life? Also, is the health department making recommendations to local high schools about how to handle graduation? So that's a two-part question.
Mm-hmm.
So yes, we are working with not only high schools, but we're working with quite a few other groups to give them guidance on things like graduation, Little League, you name it. We're working with different groups to help them understand.
Every day.
Yeah, every day to help them understand, you know, how they can do this or how they just can't do that right now. And it's a difficult road right now, and it's not it's not easy, but they're learning ways to make through. We're working through ways for them to get their situations to happen, or finding times at which they can make it happen. It's difficult.
Schools are probably the biggest concern we all have, is how do we get our kids back to school? That's absolutely essential. And all I can say is there are a lot more questions right now than there are answers.
That's correct.
There is no question. We have a lot of work to do between now and August, but we're there. We're working with them. The schools, RESA, everybody's on the same page. We want to make education a priority, but we need to make it, I hate to use the word safe, but we want to reduce the risk as much as possible, and that's what we're going to do. And follow obviously whatever rules or executive orders come out as well. So we also have to follow the guidelines from our government. So
and we're meeting with that group very, very soon to start that off.
Yeah, I already have actually.
Yeah.
So going back to the magic number, no, there's no magic number. People, go back 2 slides. Of course, if the magic number were 0, we'd be home free. That means that it's over, the virus is gone, let's go back to work. But the real number, keep going back.
There it is.
It's this. The magic number is the rate. If we can get back to work as we move back into a system of engagement with each other, and that rate continues to be stable, or even better, falling, it means that what we're doing is not accelerating the transmission and creating an environment where we're going to have that big upward slope. Because the big upward slope, remember, what was it? Slow the curve?
Yeah.
That big
14 and 30 days to slow the curve.
Means that everything's going to get overwhelmed, workforce is going to get decimated, and our hospital systems are going to get overrun. So that's the magic number, is the rate.
Okay. Next question. Will the health department be visiting restaurants prior to reopening?
Okay, so I am not, it's a Steve Demick question. I think the answer is probably not visiting everyone and giving them the magic, yes, you can open, but we're certainly going to be monitoring everybody and making sure that they're in compliance. Pretty much the same way that we always do with food, food laws. So there is, likewise, we get calls from people, do we need a note from the health department to say we can reopen our business? No, you don't need a note from us. What we will do is talk to you or review what you're thinking of and make sure it's compliant and consistent with what we think are best practices. But you don't really need us to open. You need the governor to say you can open, and then from there on, hopefully you collaborate with us and we cooperate together so that it stays safe.
Okay. Next question. Are the majority of the deaths in St. Clair County from nursing homes?
Are the majority of deaths in St. Clair County from nursing homes? No. However, they are disproportionately high. I think the last time we looked at the numbers, it was a little bit over or under 40%. Under 40%. Of course, again, with 38 deaths, I think we're at 38 deaths. That percentage is not highly reliable. Again, when numbers are low, rates can sometimes be skewed, but we do have a lot more deaths attributable to nursing homes than we do from the general population. This is a standard we're seeing, or this is something we're seeing across the country. In fact, some of the recent data suggests nationally the deaths, nursing home deaths attribute about 40 to 45%. So no surprises, but certainly it underscores our need to really pay attention to this population and work hard at keeping them safe.
Okay, next question. They say stay home if you are older or at risk. How do they expect that if you are called back to work? Is there some sort of order that protects your job or insurance if you do not feel safe to return to work?
Do you want to answer that question?
So
that's a tough one.
That is a tough one. I don't believe there's a EO or governor's order that protects you necessarily. What there is there's an order that says if you are sick or believe you or a family member is sick, you have
the right
to stay home for 14 days, right?
Yeah.
To protect yourself or your family. But it doesn't give you an indefinite period, if that makes sense. So,
I don't know if it's limited to the number of days, though, because some people's recovery rates can be quite a bit longer.
Yeah, it doesn't
but
limit
I know you
to 14 days.
You can't be punished for staying home for a COVID-related illness.
That's what it says.
But I don't know that there's any protection in the law if you are just afraid to go back to work.
Correct.
Which is why we want to work with employers and people to try and help people balance that fear from the reality of what this is all about.
Yep.
Yes, there is now a greater risk of getting sick from this disease as before back in January, maybe December. However, this risk is going to be with us. It's not unlike a risk of during flu season or a risk in a bad car day when there's sleet on the roads. You might get in a car accident by going out. We just have to temper that risk with things that you can do to help. And hopefully we'll be able to walk people through this so that they're a little more comfortable.
I will follow up on Facebook with that. I'll get the right answer. For whoever asked that question, I will get you the right answer, and I will answer back on the feed on that one. I'll get the right EO number for that.
Thank you. Why are we grouped with Detroit and not the Thumb area for reopening?
I'll let you do that
Yeah,
one.
I'll take that one. So I think almost 45% of our workforce in St. Clair County travels out of the county south to either Macomb County, Oakland County, or Wayne County to go to work every day. And that was one of the leading factors for our county to be lumped into Region 2. So that's basically why we were where we are.
Our risk comes from who we get exposed to.
That's right.
And most of us go south to work, to play, to shop, to visit friends and relatives.
Right.
And so that is where our risk is going to come from. I would say that our risk is more definitely tied to the southern regions than it is to Sanilac or Lapeer County.
Yeah.
Love Sanilac, Lapeer County, love them, love to go there, but I don't think that's where the risk is going to be.
Agreed.
Okay, someone wanted to know, what is the status of testing in the senior facilities, long-term care facilities?
Well, we've made great progress with that, and we're going to continue to push that really hard. We have, at this point, tested every resident in all of our large skilled nursing facilities, and many of the staff, not all the staff, but all of the residents. We have, in some cases, these residents now are on their second round of testing, and we'll continue to go back and support that. We're moving now on to some of our smaller facilities, other places where vulnerable populations live, and we have a dedicated staff that is working and doing this. The best hope we can is by knowledge we can continue to improve people's infectious control protocols so that they can continue to protect and isolate people. It's inevitable, and we are in fact finding COVID pretty much everywhere we look. Not everywhere, but we are finding it, in which case it just tells that facility what more they can do. It gives everybody that awareness that, hey, you can have COVID and not be sick. That's something we're finding a lot, which is another reason why just screening people for illness is not going to be adequate to keep this infection out of your facility.
Okay. Someone is confused because they had looked at the Michigan START map and that U of M is working on
Yeah.
real
Right,
estate,
yep.
and their numbers do not reflect ours. And then there's always questions too about why do the numbers change on our county map?
Well, there's two ways. Now, if they're talking about the U of M START map, is that up already?
It is, yes.
We were just talking about that because we knew that would cause confusion, because there's a couple things. Number one, it's this whole issue of confirmed cases with probable cases. And when you start looking at the two of those, we count them, we separate them now, do we not? Many places are still combining them. I think the state is still combining them.
They're only doing confirmed.
Oh, they're only doing confirmed. Okay, so there's the difference. So how you count cases. I think the probable cases are real important in our community because these are cases that our staff has directly talked to. The vast majority of them are family members of confirmed cases. So we're pretty sure that they have COVID even though maybe they didn't go and get their test. That's another story. The other question is, though, the fact that the U of M dashboard is going to be using averages per million, where we are just providing numbers. And when you start doing the calculations per million or per 100,000, obviously it changes that number. So I think we did the numbers for our per million cases. I don't know. It changes the number significantly, though. So you have to look carefully at how they're reporting the data, and that generally will explain. They are, by the way, pulling the data from exactly the same places we do. They're pulling it from MDSS, exactly the same places that we do. So the numbers really aren't different. They're just calculated and displayed a little differently.
Yeah, and when you look at that map too, unless you really know what you're looking at, it's very difficult to understand some of the data. So it could be very confusing for some people just because
I think they're going to
so
fix that.
difficult.
I think they're going to have a couple of iterations of this dashboard so that it'll be a little easier. The goal of this dashboard, though, is similar to what I was talking about more. Instead of just focusing on numbers and cumulative numbers, we really want to look at where we're going.
Right.
And that dashboard is also going to provide opportunities to look and see where you're at as a county as far as that phase, phase 1, phase 2. Are we high risk, moderate risk? And that's going to be a nice component of that.
Yeah, and the governor's plan for that is it should give you a snapshot of how long potentially will it be until you get to that next phase. That's her plan. That's U of M's plan. And I think it'll be a good tool for our community to understand how far away we may be until we get there.
Versus what? Ours? That's all right. We won't go into that.
Yeah.
Okay. Why are we not using convalescent plasma in our area, and why do I have to go to Wyandotte?
Two different questions. So convalescent plasma is being used therapeutically in our hospitals, number one, okay? Not a lot because there's not a lot available, but it is being used and acquired by our hospitals to treat those who are very severely ill. However, the Red Cross does not have a facility in our community that is extracting that. So our plasma donation centers are not connected to the Red Cross, and that's not where you would go. So right now, those are just the places that Red Cross has opened. And unfortunately, until they decide to expand or do more, I believe it's Wyandotte, West Bloomfield, and some other place. But that is the place. But I do encourage you, if you are a confirmed COVID person who's recovered, please go on the Red Cross website and take a look at that, because we would desperately appreciate your convalescent plasma. It could be a lifesaver to somebody, and the website will clearly tell you how to apply and to move towards that. So thank you for that question.
Okay, since there is more testing being done, are the new cases of antibody tests being counted as new cases or recovered cases?
No, antibody testing reporting has, as you probably have read in the paper, been a confusing issue all over the country as well as the state. What we do here in the county, when we get an antibody positive test, first we look at, is it an IgM or an IgG? IgG is meaning you have recovered, and we don't count those as cases, okay? You may have had it, but we don't count it as a case. Sorry. Unless we know that you had a case because you had a positive PCR test earlier and then you're still a case. We don't count you twice, okay? The IgM is a little trickier, and I believe what our staff does, they go back and they look and see if you've been ill. They encourage you to get the PCR testing, and then they utilize that, that scenario to put you into the queue as a probable. So you're only going to be a confirmed case if you get the PCR testing of your nose. So you could be counted as a probable, but not just based on your antibody test. You have to have a link epidemiologically to somebody who's known to have it, you have an exposure history, and you have to have shown signs of illness. So if you were an asymptomatic, somebody walk in, never knew you were sick, you have positive IgM, you're probably not going to be counted as a probable for us. And that's important because these tests are still not highly reliable. And so we're really struggling with the antibody testing and how to count it. Hopefully that'll get better.
Okay. Next question. Should people proceed with regular flu vaccinations when available?
Of course
Yes,
you should get your
absolutely.
flu shot. This is not the flu. A flu vaccine is not going to protect you against COVID, but as you know, flu season starts in the fall, sometimes early winter, accelerates and comes down. Why would you want the flu and COVID at the same time? There's no question we're going to have COVID circulating throughout the fall and winter. So flu vaccines help protect you against serious influenza, helps significantly keeping people out of the hospital, and significantly helps people from not dying. And it's always going to be recommended, and I think particularly in a season like this where we have a lot of disease and concerns, it's one more thing that you don't hope that you can do for yourself. All right, and it doesn't say you get a flu shot, you don't have to worry about the flu, but chances are you're not going to be nearly as ill from it, and it'll help you kind of weather the storm, I think.
Okay, next question. What is the status of county libraries and beauty shops?
Okay.
I didn't do it.
Yeah, so county libraries are going to remain closed to the public for probably quite a while, just due to the manual touching and the transmission of goods that libraries have. You know, there'll be more to follow on that, but that's where we are with libraries for now. And the same thing with you know, beauty shops and hair cutting, nail salons, things like that. It's the same thing. There's so much manual touching and things like that. You can't. There's so much opportunity for this disease to pass back and forth just because of the closeness that the provider has to have with you. It's just not safe at this point to have those services available.
Okay, we're proceeding it to 3:58. Would you like to answer
Oh
one more
my
question?
gosh,
about
time
each of
flies.
your
Yeah.
sheets, and then we'll do closing.
I don't know. I think I answered all the questions. So I'll just say thank you for your interest. This is hard. People are doing great. I can tell you that I think this is because of what all of you are doing. The sacrifices you have made in these last 3 months has resulted in all of us doing better. So thank you for that. And please don't give up. We still have a lot of work to do, and we just have to hold the course and stay the course and keep doing this hard work. But it's worth it. So thank you.
Yeah, and you know, I'll second what Dr. Mercatante says. We're getting into the summertime. You know, the summertime is when everybody wants to be outdoors and wants to get together and have the parties. And we have a little more opportunity now in these groups of 10. But as you get together with your friends and your family and you enjoy yourselves outdoors, just please remember to create a little space in between each other. It'll pay you back in dividends. Take care of yourselves. Take care of each other. We're all in this together, and I appreciate each and every one of you in our community, and we look forward to talking to you again next week. Thanks, everybody.
Can I say one more thing? Don't cut me off. Hey, this mask is for the protection of the people around you.
That's right.
It's a courtesy.
And we're all wearing them.
And it's a kind courtesy for those of you who are living with elderly or people with heart disease or diabetes. Save their lives. You could be saving their lives by putting your mask on. It's
right.
uncomfortable. I think it's worth it. Thanks.
That's right. Have a great day.